Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen of the committee, as well as the conference participants. Thank you for the opportunity to share the findings of our research titled Development of Pandemic Burnout Inventory for Healthcare Workers. Okay. The idea for this study came to us after we discovered numerous research reports on burnout in health workers during the COVID-19 pandemic, including in Indonesia. Other studies have concluded that the COVID-19 pandemic has indeed doubled the risk of burnout in health workers. In my literature review, we found there are many burnout instruments, but they were developed long before the pandemic. In our opinion, their validity can be questioned because an instrument should be designed for only one specific purpose, to produce valid data for that purpose only. With this research, we hope to fill a scientific gap by developing specific burnout instrument for health workers in a pandemic situation. The aim is broken down into three major stages. The first is conceptualization, then construction, and the last is psychometric testing. This study used a mixed method with a sequential exploratory design. The study's population consists of all health workers at COVID-19 referral hospitals in Indonesia, while the research sample was divided into stages. In the qualitative stage, we employed 30 informants, 30 respondents in the pilot test, and 731 respondents in the field test. At the conceptualization stage, we used a dialectical approach, that is inductively with qualitative content analysis of interview transcripts, which were integrated with the conceptual framework deductively derived from theories. The findings conclude that pandemic burnout has 5 components: emotional exhaustion, depersonalization, low personal accomplishment, psychosomatic symptoms, and pandemic worried. Then it developed into a blueprint or instrument prototype that included 15 indicators and 60 items that represented measurement objective. Furthermore, the prototype was validated using an expert judgment mechanism involving 17 experts from the fields of psychometrics, occupational safety and health, clinical psychology, psychiatry, and occupational medicine. The experts were asked to provide feedback in the form of a rating on the items, and the result is 65% of the items were rated high validity, with 35% rated very high validity. The item content was then revised based on expert input, and a pilot test or face validity was performed on 30 respondents at Ponorogo Hospital. The field tests were conducted on-site and online. On-site at 5 hospital locations at Padang, Ponorogo, Samarinda, Makassar, and Merauke. The result of field tests are used to test the validity and reliability. The first step was to perform exploratory factor analysis, and we discovered that 29 items had a low factor loading. So we eliminated and leaving 31 items for further analysis. We used confirmatory factor analysis to the 31 items to determine the model suitability, and the results were poor, with only one indicator statistically meeting the criteria. So we decide to select the most qualified items with high factor loading criteria, strong content, and considering the proportionality and the 5 aspects. The second confirmatory factor analysis was performed on 14 items, and the results showed that 4 of the 5 indicators met the criteria. So this became the composition of the final pandemic burnout inventory. Then we perform a concurrent validity analysis by comparing pandemic burnout inventory to two other psychometrically tested instruments. And the result revealed a good correlation. Item discrimination and Cronbach alpha coefficient were used to estimate instrument reliability, and the results were generally positive. So shortly, our study is talk about the pandemic burnout inventory was developed due to the theoretical development, empirical progress, and practical needs. Pandemic burnout is conceptualized as a syndrome felt by health workers during the COVID-19 pandemic, which is characterized by feeling of emotional exhaustion, depersonalization, low self-performance, accompanied by psychosomatic symptoms and pandemic worried. Since the initial draft, the pandemic burnout instrument produced 60 items, then it reduced based on qualitative and quantitative evaluation to 14 items. In general, the pandemic burnout inventory meets good criteria, namely valid, reliable, objective, standard, and practical. So there are our references, and thank you for your attention.